COVID-19 pandemic. The statement says the Commonwealth is committed to protect the health of all 2.4 billion of its citizens by improving access to essential health services and safe, effective and affordable medicines and vaccines for all, particularly the most vulnerable and high-risk populations. They will work with international partners to address the global threat from the pandemic, supporting the G20 and international financial institutions' action plans to tackle the crisis. This includes protecting employment opportunities, particularly for the Commonwealth's 1.2 billion young people. Now, to talk more about this is Commonwealth Secretary General Patricia Scotland, who is joining us all the way from London. Good afternoon, madam. You told me it's a good morning from your end. Thank you so much for joining us on Bottomline Africa, Madam Secretary General.
I'm delighted to be with you in this wonderful Kenyan afternoon.
Certainly. Thank you so much, madam. Now, straight on to Commonwealth's response to COVID-19 and, of course, its impact on supply chains for essential medical supplies.
Well, this has been a critical issue for the whole of the Commonwealth. As you know, we are 2.4 billion people, 60% of whom are under the age of 30. And our 54 countries have come together as equal sovereign countries to face this pandemic in a way that has been really commendable. Because the ferocity of the COVID-19 pandemic and its extensive reach means that it has really revealed that we have shared vulnerability in the face of global crises. And it demonstrates that although these are sovereign and independent, different countries and peoples, we are so interconnected and interdependent. And this is why we have been advocating to have a coordinated, multilateral approach, because this has proved to be crucial for our joint success. And the Commonwealth has really been a unique platform for international cooperation, with the ability to convene our 54 countries from 5 different regions, including some of the largest and richest countries in the world, but also some of the smallest and most vulnerable, the developing and the developed. And when we come together as equals in order to find the solutions that are so desperately needed. And those solutions have started to appear, because this call for multilateral action has been responded to really enthusiastically by our Commonwealth family. And as a result, together, the Commonwealth Secretariat has been able to be incredibly proactive, exploring and trying to create some of the innovative tools and programs that we need. And we've been able to rely on all our member states to help us. And together we have looked at how we create and support universal health coverage. We've created a coronavirus response centre and tracker. We've also got a price sharing database for procurement and medical essentials, because what we found is particularly the small and the more vulnerable countries are finding it so difficult to get the sort of equipment and medication they need. So this database is really there to help those who are needing this sort of assistance. But then we've got the Commonwealth Meridian for debt management, because regrettably, many of our countries are going to be struggling with debt as a result of this pandemic. And we've got a disaster risk finance portal we're in the process of creating, because as you know, in Kenya, we are also not just facing the pandemic, but we're dealing with the climate crisis as well. So knowing how we can pool our resources to respond to these disasters is so important, because pandemic is only one, unfortunately, of the things we're now having to deal with. But we're also looking at the Commonwealth connectivity agenda for trade and investment, because what we've been told and what all the specialists tell us is it is likely that we are going to lose about $2 trillion from the world's global economy, and 220 billion of that is likely to come from developing countries, not including China. So we have huge challenges, but we also have considerable opportunities because of our partnership and because we are sticking together. And this is what's been something which has been marvelous coming out of the difficulty, but it's been heartbreaking. And I think there is not a family, not a country in our 54 who have not been grievously wounded by what has happened in COVID-19. And I'm so proud of what the Kenyan government has done, not only to keep Kenyans safe, but also to try and restart the economy. So that $503 million that the Kenyan government has contributed to help those in difficulty, I think is going to make a real difference. And there's a lot of applause for what Kenya has done.
Indeed, Madam Secretary General, but you mentioned it, climate change, and I'd like us to talk more about that, because if I'd put it this way, this is also another pandemic. I mean, we are dealing with COVID-19, but climate change has been an issue for long. So let's talk more on the Commonwealth's assistance to help countries dealing with dual threats, specifically or particularly climate change.
Well, climate change has been something, as you know, that the Commonwealth has been absolutely committed to since 1989. We were the first. When we came together, the Commonwealth leaders came together in Langkawi in Malaysia, and they made the Langkawi Declaration, where we said that climate change was an existential threat, and that if we didn't deal with it immediately, then the consequences would be grave. And the Commonwealth has continued to bang that drum. But you've seen what has happened this season. We've had the Pacific once again struck by Cyclone Harold. We've seen in Asia, Cyclone Amphan really batter. It's the biggest cyclone that the Bay of Bengal, which has over 500 million people, has ever seen. And Gujarat was hit. But look at Kenya. We've had floods, and now we have areas of desertification, but then there's the locusts. And they're saying that the locusts are eating more in an hour than 35,000 people would eat in a day. So these are real problems that we are all facing. But the threat of these joint shocks are such that we are absolutely committed to addressing them together. And so if you look at what we've been able to do, we have developed the Commonwealth Climate Finance Access Hub, and that is enabling us already to get over $33.6 million to our countries, but there are $575 million in the pipeline because we need to adapt. We also need to respond in a way that we can mitigate. And this has led us to look at how we can create a regenerative model of development in order to help our countries. But if you look at what Kenya has done, we've been absolutely thrilled that Kenya has participated in the Blue Charter. It is Kenya who is leading on blue economy, but we are looking at how we can make our economy blue and green too. But you know, if we're going to face this climate, we also have to understand that tragically women and children are most disadvantaged by it. And this is something that we are absolutely concentrating on. And our interventions have been on a plethora of areas. So for example, we are looking to develop a universal vulnerability index because we know it's not just size and economy, climate adds to our vulnerability. So in our universal vulnerability index, we aim to better capture the different quantifiable aspects of vulnerability, such as the remoteness, the high economic exposure, the proneness to natural disasters related to climate change, rather than just focusing on capita GDP, GNI alone. And the Climate Finance Access Hub is a really important opportunity for us. That 575 million that I spoke about, I think has now risen to 650 million pounds worth of projects in the pipeline. Then we've got common sensing. which is an innovative project that harnesses satellite remote sensing in Fiji, Solomon Islands, and Vanuatu. But that data and that approach we're using with the Caribbean, and we want to use it for all our regions. And this opportunity to match what we're doing in oceans with our Commonwealth Blue Charter and our ocean solution as part of the climate change and the digital transformation area, all of these coming together, I think are going to make a real difference. But it's not just climate, because we have to keep ourselves healthy. If you look at the pandemic, we are frightened that this may not be the last pandemic. And so our health ministers, when they met in May, were absolutely committed to say, we have to look at non-communicable diseases. We've got to look at heart disease, obesity, and diabetes, because when we've looked at those who've been badly affected by COVID, we've seen that those with an underlying illness have really suffered more. And that leads us onto sport, because we are going to have the sports ministers meeting later this month on the 23rd, which will be led by the wonderful and great Amina Mohammed, who is your Minister for Sport. She is chairing that meeting. And we are going to be looking at how we can use sport for health, for sport also to build trade. Because what we know is we have fantastic sportsmen and women right the way across the Commonwealth. But not all of our countries are able to take advantage of that wealth in terms of turning it into a sports industry. So we will be looking at how we can help with trade. And I'm very certain that this will be greatly helped by the good leadership that we are currently benefiting from your wonderful Amina Mohammed, who is a jewel as far as our Commonwealth is concerned.
Indeed, Madam Secretary General, I'm told we're out of time, but it has been such a pleasure having you on this show. Thank you so much for joining us, Madam Secretary General of the Commonwealth, Patricia Scotland. Thank you. Here we say Asante Sana,
Okay.
Madam.
Asante Sana.
Yes, that's thank you. And you say Karibu.
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 Yes, Madam Secretary General. Thank you so much.
so much.
It was a pleasure having you on this show. So we're taking a short break here on Bottomline Africa, but stay with us. Lots more after the break, even as an I'll leave you with Destination